The Edmonton Diabetes and High-Risk Foot Clinic brings all kinds of diabetes professionals under one roof. The public clinic opened in May 2023. One of their specialties is diabetic foot ulcers.
This is a serious problem because it's not just a blister or a sore on your toe and that's the end of it. This is now a portal of infection. Patients now they need antibiotics. They end up in hospital. They can become very sick.
The worst cases can result in amputations or even death. Jerry Grinling was in the lobby of his dentist when he stepped on a little rock.
It almost felt like I stepped on a spike. It hurt like you wouldn't believe, and I thought it pierced the skin.
When he checked his foot a few minutes later, it was just a little red. 2 days later, though, something was clearly wrong.
So I looked at the bottom of my foot and there was a blister that had popped. That blister turned into 18 months of hell for me.
He fought cellulitis twice, with the bacterial infections going up to his knee. Grinling has type 2 diabetes. This seemingly small foot injury resulted in 2 trips to the emergency room and 30 days of intravenous medication. Dr. Daniel Shaprin says 1 in 3 diabetics will have a foot ulcer at some point in their life, and they're very dangerous.
They're far more likely to develop a wound, and then they are often, unfortunately, noticing it a lot later. They don't get the pain.
Grinling did feel the pain. His ulcer had to be repeatedly debrided. They used wound pumps. It was very difficult to heal. Now he comes to the clinic every 6 to 8 weeks for preventative medical pedicures.
Patients will have their feet, they'll be washed, moisturized, they'll get a full inspection of their feet between their toes. They'll be provided tips for what they can and can't or shouldn't do at home.
His advice to others?
Check your feet every day.
Sarah Ryan, Global News.